Please welcome Stacy London to the show. Who, incidentally, I love the story that your style, your sense of style, was really born out of some of your struggles with psoriasis.
Yeah, I mean, I think my inclination towards all things sparkly and pretty and perfect sort of came out of the fact that I was diagnosed at the age of 4 with psoriasis, and I never felt okay. You know, I'm being that young and being diagnosed with a disease, a chronic lifetime disease, made me feel very different very early on. And even though when I first got it, it wasn't very severe, it got very severe. By the time I was 11, I was covered in red scales from my neck down. And I had crazy thick scalp psoriasis. So I had longer hair than I do now. And because we had to put all sorts of things and goo and stuff in it every night, and I would wear a shower cap, my mom would have to scrub it out with boric acid every morning. And so it got to be too difficult, and we had to cut off all my hair. So at 11, being covered in red scales and having a crew cut, you can imagine, it wasn't the easiest time of life, but it definitely made me feel completely insecure. But even after it started to get a little bit better, those feelings of insecurity, I don't think ever really went away. And it's hard enough to be 11 years old. Imagine, having notes in your locker that say you're uglier than the Elephant Man or get out of school before you infect us. And
that's a really good point, because I think a lot of people misunderstand psoriasis and other skin conditions, because psoriasis, as you can see on this animation, it is not an infection. It is literally your immune system gone awry. It is an autoimmune disease. You hear us talk about that a lot. But in this case, your immune cells, as you see here, actually attack your skin. And when they attack your skin cells actually rapidly replicate and then die off. And what it does is it creates these very intense, scaly patches that Stacy is so familiar with. You see them oftentimes on your elbows, your knees, your back. But as Stacy mentioned, it can be almost anywhere. And also, it may not look like your classic psoriasis. There are things called psoriasis that look like bug bites. And so if you have bug bites and they never ever go away, it could be psoriasis. Not everything's the classic plaque psoriasis that you're describing.
Yeah, I mean, looking at those pictures, I have to say, is like it's bone chilling for me, because I really am so empathetic to people who suffer from all sorts of autoimmune diseases, because they're so tricky. They present themselves in so many different ways. You don't know whether they're going to get better or worse. A lot of different things, sort of play a part here. The thing about them that's so tricky is not only are there so many different sort of permutations of the diseases themselves, every person is different, and every person is going to have a different kind of reaction. So sometimes you may get better, sometimes you may get worse. Some people get worse and stay that way. Some people get better and stay that way. It's really such an individual disease, which is why I partnered with AbbVie to do this campaign called Uncover Your Confidence. And there were a couple of reasons. The first is really understanding that a lot of people who get this disease are so challenged psychologically and emotionally, that it's not life-threatening, but that it is so emotionally disabling, and that a lot of people give up hope. And so one of the things that was most important about this campaign was to kind of empower patients, not only to go out and find the right kind of care. You must find the right dermatologist, because I'm sure, as you guys know, not all dermatologists specialize in psoriasis or even autoimmune diseases. So it's really important to find the right care, but also to empower yourself by not thinking that your skin or your disease defines you.
So well said. Stacy, thank you for what you're doing. You can learn more about Uncover Your Confidence by visiting thedoctorstv.com.